Welcome to this session. Welcome everyone. My name is Victor Garcia, and today I will be presenting on three essential staffing concepts in nursing: nurse-patient ratios, patient acuity, and floating. And let me share with you my screen for a second. I'm gonna go there in a second. Nice. These concepts directly influence the patient outcomes and the nurse workload and overall the safety in care environments. Through this presentation, we will break down each of these concepts, the meaning of them, and actually why them matters, and how the evidence supports and safe staffing practices as well. Now, a nurse-patient ratio describes the number of patients assigned to one nurse per shift. Acuity reflects how sick or complex a patient is and how much nursing time they require. And floating refers to being reassigned to another unit to meet staffing needs. Understanding these three definitions is essential because they form the foundation of staffing decisions in real clinical settings. Now, why these matter? Safe ratios helps reduce mortality, prevent errors, improve nurse satisfaction, which is really important, and ensure patients receive timely interventions. Research consistently is going to be showing us that when nurses are assigned too many patients, critical assessment and care can be delayed or missed. Lower ratios also help to reduce burnout and turnover, supporting a stable nursing workforce. Our actual current standards here in the US, the American Nurse Association emphasize that staffing should be based on acuity and patient needs. Some states like California have mandated minimum ratios, while others rely on staffing committees or public reporting. Standards could vary widely across the US. Actually, that creates challenges for consistency in patient safety practices. Now, regarding acuity, the patient acuity, that measures the severity, the complexity, and resource intensity of a patient care's needs. High acuity patients require more nursing time, frequent assessment, and complex interventions. Acuity can vary as well, shift to shift, so staffing must adjust accordingly. How we can assess acuity? Most hospitals use scoring tools or classification systems that consider factors like vital signs or cognitive status or mobility or required interventions. These tools help to quantify workload and distribute patients more equitably among nurses. Accurate assessment is essential for ensuring that staffing aligns with patient needs. Uh, Regarding the impact of acuity-based staffing, this staffing improves the workload balance, increases the patient safety, and enhances the nurse satisfaction. It ensures that nurses caring for higher acuity patients have fewer assignments and prevent overload. Research supports that this approach is as one of the best practices and ensures quality and safety. Now, what is floating? This is going to be occurring when nurses are temporarily reassigned to a unit outside of their home and outside of their area. And it's often necessary to accommodate census changes or staffing shortages, while floating helps to maintain operational flexibility to the center. It also can introduce safety risk if the nurse is unfamiliar with the unit. Which are the pros and cons of floating? Now, floating can be beneficial sometimes because it helps to redistribute staffing resources and can expand a nurse skill set. However, challenges include stress, unfamiliar workflows, an increase of errors. The risk of errors is going to be higher. Then ensuring nurses feel supported is the key to minimize the negative effects. Strategies to improve the safety of floating includes providing orientation to the receiving unit and verify competencies, which is going to be essential, establishing dedicated float pools, and pairing float nurses with experienced staff. These measures reduce the risk and help ensure the patient safety. Now, let's discuss our case scenario. Imagine we have a med-surg unit and it's short-staffed. If we have, for example, one RN is short in a night shift, and a float nurse unfamiliar with the unit is assigned to a full load. Over the shift, several signs of deterioration could be missed and they could be resulting in a preventable patient fall. Then this scenario illustrates how inadequate staffing and insufficient float preparation can directly affect or impact the patient outcome. And in this case, the patient, after it falls, it fractures a hip, suffering a harm and longer state and anxiety. The family is going to be upset, and the staff is going to be reporting low morale and cite unsafe conditions. Then what's going to be the resolution? The hospital created a float orientation and mentorship program. That's going to be one of the solutions. And all float nurses now shadow unit staff for a shift and receive protocol checklists. They adjusted staffing to ensure that at least 1:5 ratio on med-surg nights. And these are the results achieved. And fall rates decreased significantly after the program. Nurse reports feeling more competent and float shift, and the patient satisfaction score improved. The staff morale, especially, and retention increased. Now, which is the evidence for staffing ratios? The research shows that higher RN staffing is associated with lower mortality rates and fewer adverse events. Acuity tools have been shown to improve workload fairness, and the outcomes can vary depending on the implementation. And some preliminary data also suggest that dedicated float pool nurses perform more safely than frequently float staffed. Some other recommendations after reviewing the evidence is going to be based on the evidence, the best strategy include maintaining the safe nurse-patient ratios, using acuity-based staffing systems, supporting nurses who float, and creating healthy work environments. And these approaches help safeguard patients and prevent burnout. Then these are the recommendations for ratio and acuity, and these are the recommendations for floating and work environment. Finally, we can conclude in summary. Safe staffing is essential to high-quality nursing practice and nurse practice ratios, acuity-based staffing, and well-managed floating and contribute to safer outcomes. By implementing evidence-based strategies, the healthcare system can protect both patients and nurses. And here you can read some of the references that I use for these presentations. All sources are within the past 5 years and based on peer-reviewed research or national guidelines. Thank you very much.